The topic of cannabis use among mothers during pregnancy and breastfeeding is increasingly relevant as more women seek alternative therapies for various ailments. However, a significant stigma surrounds mothers who choose to use cannabis for medicinal purposes, often leading to feelings of guilt and isolation. Many in society view cannabis use as irresponsible, particularly for those who are pregnant or nursing, which can deter mothers from discussing their experiences or seeking support. Women like JC and Alexandria have emerged as advocates, sharing their personal journeys and emphasizing the therapeutic benefits of cannabis. They highlight how cannabis has helped them manage conditions such as anxiety and chronic pain, ultimately improving their overall well-being and ability to care for their children. Their stories challenge the prevailing narrative and encourage a more nuanced understanding of cannabis use in motherhood. As we delve deeper into this topic, it is essential to consider both the medical and societal implications of cannabis use during this critical period. This discussion will encompass the potential benefits and risks associated with cannabis consumption, as well as the need for more comprehensive research and education. By addressing these issues, we can foster a more informed dialogue that respects the choices of mothers while also considering the health and safety of both mothers and their children. Mothers often face intense societal judgment regarding their parenting choices, with one of the most scrutinized decisions being the choice to use formula instead of breastfeeding. Despite the fact that formula can be a necessary and valid option for many families, mothers who opt for it frequently encounter criticism and unsolicited advice, leading to feelings of inadequacy and guilt. This judgment extends beyond feeding methods. Mothers who return to work shortly after giving birth often face stigma as well. The societal expectation that mothers should prioritize their children above all else can create a harsh environment for those who choose to balance work and family life. Additionally, mothers who use cannabis for medicinal purposes while navigating their roles as caregivers often find themselves at the center of scrutiny. The stigma surrounding cannabis use compounds the challenges of returning to work, as these mothers may be unfairly labeled as irresponsible or neglectful. This harsh scrutiny is particularly pronounced when compared to other demographics, such as fathers or non-parents, who often do not face the same level of judgment for their choices. The societal pressure on mothers to conform to idealized standards of parenting can lead to significant emotional distress, making it crucial to foster a more supportive and understanding environment. By recognizing the complexities of motherhood and the diverse circumstances that influence parenting decisions, we can begin to dismantle the stigma and judgment that many mothers face in their daily lives. JC's personal experience with cannabis during her pregnancy is a testament to her journey of seeking relief from debilitating migraines. For years, she struggled with severe headaches that often left her incapacitated, making it challenging to manage daily tasks and care for her family. Faced with the prospect of using opioids, JC was deeply concerned about the potential risks associated with these powerful medications, particularly during pregnancy. She was aware of the stigma surrounding cannabis use, yet she felt compelled to explore it as a safer alternative. After consulting with her healthcare provider, JC made the informed decision to use cannabis to alleviate her migraine symptoms. The relief she found through cannabis was remarkable. It provided her with a level of comfort and functionality that traditional medications had failed to deliver. Unlike opioids, which often came with a host of side effects and dependency risks, cannabis allowed JC to manage her pain without compromising her health or the well-being of her unborn child. This newfound relief not only improved her quality of life, but also enabled her to engage more fully in her pregnancy. JC's experience highlights the importance of considering alternative therapies and the need for open conversations about cannabis use among expectant mothers. By sharing her story, she hopes to challenge the stigma and encourage other women to seek the relief they deserve without fear of judgment. Alexandria faced numerous challenges during her pregnancy, grappling with severe symptoms that included debilitating nausea and anxiety. These issues not only affected her physical health, but also took a toll on her mental well-being, leaving her feeling overwhelmed and isolated. In her search for relief, Alexandria began researching cannabis use during pregnancy, delving into studies and personal accounts to understand its potential effects. She discovered that many women reported positive outcomes, including reduced nausea and improved mood, which piqued her interest in exploring cannabis as a viable option. After careful consideration and discussions with her healthcare provider, Alexandria made the decision to incorporate cannabis into her treatment plan. Hoping to alleviate her symptoms without resorting to traditional over-the-counters or narcotics that often came with unwanted side effects. As she navigated her journey, Alexandria became an advocate for herself, actively seeking out information and support from others who shared similar experiences. Recognizing the need for a community, she took the initiative to create a support group for pregnant women considering cannabis use. This group not only provided a safe space for sharing experiences and advice, but also fostered open discussions about the stigma surrounding cannabis. Through her advocacy, Alexandria aims to empower other women to make informed choices about their health and well-being during pregnancy, emphasizing the importance of support and understanding in a society that often judges mothers for their decisions. The establishment of the Mother's Mary organization emerged from the collaborative efforts of Alexandria Annie, two mothers who recognized the need for support among women using cannabis during pregnancy and breastfeeding. Their shared experiences and challenges motivated them to create a safe space where mothers could connect, share their stories, and find resources related to cannabis use. Together, they envisioned an organization that would empower women to make informed choices about their health and well-being without fear of judgment. The mission of Mother's Mary is centered on providing education, advocacy, and community support, helping mothers navigate the complexities of cannabis use while emphasizing the importance of personal choice. By fostering an inclusive environment, Alexandria and Annie aim to dismantle the stigma surrounding cannabis and promote open discussions about its potential benefits and risks. Since its inception, the online community has experienced significant growth, attracting mothers from diverse backgrounds who seek connection and understanding. This vibrant community has become a vital resource, offering a platform for sharing experiences, advice, and information about cannabis use. The impact of Mother's Mary extends beyond individual support. It has sparked broader conversations about maternal health and the need for more research on cannabis. Through their efforts, Alexandria and Annie have created a movement that not only uplifts mothers but also advocates for their rights to choose what is best for their bodies and families, ultimately fostering a more compassionate and informed society. Dr. Katrina Mark's research on the effects of cannabis use during pregnancy provides valuable insights into the medical viewpoint surrounding this complex issue. Her studies focus on how cannabis exposure can impact fetal development, examining both short-term and long-term effects. While some women report relief from symptoms such as nausea and anxiety through cannabis use, Dr. Mark emphasizes the need for caution, as research indicates potential risks associated with prenatal exposure. These risks may include developmental delays, cognitive impairments, and behavioral issues in children, raising concerns about the implications of cannabis use during this critical period. Dr. Mark advocates for a balanced approach, recognizing that while some mothers may find cannabis beneficial, it is essential to weigh these benefits against the potential risks to the fetus. This highlights the importance of informed discussions between mothers and their healthcare providers. Open communication allows mothers to express their concerns and preferences while receiving evidence-based guidance tailored to their unique situations. Dr. Mark encourages healthcare professionals to create a supportive environment where mothers feel comfortable discussing their choices without fear of judgment. By fostering these conversations, mothers can make informed decisions regarding cannabis use, ensuring they consider both their health and the well-being of their developing child. Ultimately, the medical community aims to provide comprehensive care that respects mother's autonomy while prioritizing the safety and health of both mother and baby during pregnancy. Mothers who have chosen to use cannabis during pregnancy often share a range of personal risks and benefits based on their experiences. JC, for instance, highlights her perspective on the risks associated with cannabis compared to opioids. While she acknowledges the potential concerns surrounding cannabis use, she emphasizes that the risks of opioid dependency and the side effects of traditional pain medications were far more daunting for her. For JC, cannabis provided a safer alternative that allowed her to manage her debilitating migraines without compromising her health or the well-being of her unborn child. Many mothers report experiencing significant emotional and physical relief through cannabis use, noting improvements in anxiety, nausea, and overall mood. This relief can be transformative, enabling them to engage more fully in their pregnancies and parenting. However, these mothers also recognize the importance of weighing the benefits against potential risks, as each individual's situation is unique. It is crucial for viewers to consider their own health needs and choices when it comes to cannabis use. Open discussions with healthcare providers can help mothers navigate their options, ensuring they make informed decisions that align with their values and circumstances. By sharing their stories, mothers like JC encourage others to explore the complexities of cannabis use, fostering a supportive environment where personal experiences can inform choices and promote well-being during pregnancy and beyond. Ultimately, the decision to use cannabis should be made thoughtfully, considering both the potential benefits and risks involved. The importance of community support for mothers using cannabis cannot be overstated, as many women often experience a profound sense of isolation in their journeys. The stigma surrounding cannabis use, particularly during pregnancy and breastfeeding, can lead mothers to feel alone and misunderstood. This isolation can be exacerbated by societal judgments and a lack of open dialogue about their choices. In this context, online communities like Mother's Mary play a crucial role in providing a safe haven for mothers seeking connection and understanding. These platforms foster a sense of belonging, allowing women to share their experiences, ask questions, and find reassurance among peers who face similar challenges. The positive impact of such communities is evident, as they empower mothers to discuss their cannabis use without fear of judgment, creating an environment where they can learn from one another and share valuable resources. Encouraging mothers to share their experiences is vital, as it not only helps to normalize cannabis use, but also builds a supportive network that can alleviate feelings of isolation. By engaging in these conversations, mothers can find solace in knowing they are not alone in their struggles and choices. Ultimately, community support is essential for fostering resilience and confidence among mothers using cannabis, enabling them to navigate their unique paths with the understanding that they have a network of support behind them. This collective strength can lead to more informed decisions and a greater sense of empowerment in their parenting journeys. In summary, the video highlights the importance of understanding the complexities of cannabis use during motherhood, emphasizing that this topic encompasses a range of personal experiences, medical perspectives, and societal implications. We explored the stigma that mothers face when choosing cannabis for medicinal purposes, as well as the powerful stories of advocates like JC and Alexandria, who have navigated their own challenges and found relief through cannabis. The discussion also included insights from medical professionals, such as Dr. Katrina Mark, who provided a balanced view of the potential risks and benefits associated with cannabis use during pregnancy. Additionally, we underscored the significance of community support, particularly through online platforms like Mother's Mary, where mothers can connect, share experiences, and find solace in knowing they are not alone. As we wrap up, we encourage viewers to engage with the content by subscribing to the channel and sharing this video with others who may benefit from the information. Your support helps foster a broader conversation about cannabis use and motherhood, breaking down barriers and stigma. We invite you to explore more related topics on our channel, where we delve into various aspects of maternal health, wellness, and the choices mothers make. Together, we can create a more informed and compassionate community that empowers mothers to make the best decisions for themselves and their families. Thank you for joining us in this important discussion.